for Social Women with your hosts, Pat Cruz, Amy Diaz, and Bronwyn Dannenfelser.
Welcome back to Social Women. I'm your co-host, Pat Cruz. Our toll-free number is 855-252-2020, and I'm here with Bronwyn Dannenfelser. And our third love, Amy Diaz, is out of the studio today.
She's on vacation.
Not fair.
No,
in
totally
sun
not.
and fun. She's in Florida.
We miss you, Amy. That's
Yes.
why we're saying this. We miss you terribly.
We do miss you, and she's been on her social calendar 2 weeks, 2 weddings in 2 weeks. And
Crazy.
1 week, she caught the bouquet already.
Yep.
So she's on a roll, that one. Anyway, so welcome back to Social Women. We are back again with Karen Dalton, and we're speaking about healthcare and some great options for people that are underinsured or not insured.
We're in a place right now where healthcare, I know for women, especially women between 40 and 60, it's astronomical, just the cost of it, especially if you're trying to get it independently. And we have a lot of people out there who have lost jobs, who know people that have lost jobs. And the thing that you and I were talking about is it's, people will, because they don't have health insurance, will avoid going to the doctor. It'll be one of the first things that they don't kind of, maintain is their health insurance because they can't afford it. And everybody here should have the right to access, a primary physician and talk to somebody. So when you talk about this Health Access RI and primary care physicians, I know that there's a low cost for people, right? That you can to get is it a membership again, or how does this work?
Right. So there's a one-time enrollment fee that up to $80, depending on the practice that they choose. We have a list of practices. We have 17 different practices throughout the state, and it is all through Rhode Island, northern Rhode Island, all the way to southern Rhode Island. So that's up to $80 for the one-time enrollment fee. The monthly membership is $25 or $30 a month. So for less than the cost of a cable bill, you can have a primary care services and work with a primary care physician, and have get well and stay well by creating a relationship with your doctor. So just like anybody else that has insurance, if they get a cold, they're not feeling well, they call their doctor and make an appointment, where if they don't have insurance, they wait. And when they wait, that becomes bronchitis, and the bronchitis could become pneumonia. They end up in the emergency room. Then you end up with thousands of dollars as a bill from the emergency room. And then there's a lot of people that just can't pay that either. So
When did you start Health Access RI? When?
I started with Health Access a year and a half ago.
Okay.
But it's been around for 7 years.
Oh, all right. So it's been around for a while.
It has.
Well, I think it's such an important resource to have out there. Again, a lot of our listeners probably.
We have a question, actually, that you were just answering. What happens if you need testing? What are the costs?
One of the great things is we've been able to work out some discounts with our service affiliates for X-rays, MRIs. We have Open MRI and Advanced Imaging is one of our premier affiliates that offer a discount, so that when you go in, you can get a drastic discount for those services. We have Eastside Lab that offers for your lab work and your blood work, and we also have Rhode Island Rehabilitation for physical therapy, Women's Care for OB services, and Situate Chiropractor for chiropractic services. Those are the services that we do have currently right now that do offer a discount, which is the Medicare rate, because as a Medicare provider, it's the lowest rate that they can charge.
See, that's incredible. Because was it last week? I ran into somebody who my husband must have been talking about the fact that I was going to have you on the show, who came up to me and asked me. She said, she had lost her job a year ago, and she was looking for a place to get a mammogram. She goes, I really need to go get a mammogram. I need to go get myself checked out. Where can I do this? I don't have any health insurance. So would this be something where she could call up Health Access RI? She could talk to you about maybe connecting with a doctor and becoming part of your program, and then getting some of these services for?
Well, there are some great free cancer screening services, women's services, and working with a primary care physician, even though you don't have health insurance, they know the connections, they know what you can do, and they know the programs that are available out there. So by having that relationship with your doctor, even though you may not have insurance to be able to cover some of the testing that you need done, they can work with you to tell you the best options that you have.
Is there anywhere online that actually lists the programs that are available for people?
I know 211 United Way has some offerings. There's neighborhood health plan that you can call and see if you qualify for that.
But I'm talking about actual programs that they offer free screenings for, or are they, separate to whatever the particular issue is? So whether it would be breast cancer screening, or are there programs, or is there a place that would list where you can
I
get those
see.
kind of
Like
things?
one central location where if
Correct,
you wanted
yeah.
to find. I don't know.
Yeah.
Do you list them on your website?
I don't list them on my website. We say work with a primary care physician, and when you go and you talk to your primary care physician, they can help you out with that. If it's not the doctor, it's their office staff that knows exactly what direction to point you in for what you need.
So, and can anybody come to you? I mean, and do you have to bring anything with you?
No, anyone can come to us. There is no age requirements. There's no income requirements. It's just so long as you pay your monthly membership fee. So we, have found that it works best if you just have it automatically withdrawn right out of your checking account from your card.
Yep.
And then, so long as you're paying your monthly membership fee and your office visit fee when you go, which is very reasonable, it's only $10, $15 for your office visit fee. If you have to have shots or anything that would cost the physician out of pocket, then they would pay just costs. They do not charge extra. Our physicians just charge what they would have to pay.
See,
there's
my
no
thought right now is why isn't everybody jumping on board and doing this? Essentially, because I would think that, I know how much I pay for my health insurance, and it's scary.
Yeah.
And so the doctors that are all participants in this, they're doing it at this discounted fee because they care?
Because they care. They care about their patients. They want to make sure that their patients come to them when they're sick and not wait and end up getting sicker. People that have high blood pressure need to have that checked, or people that have diabetics that need to have their blood work checked. This is a great way to have that relationship and see your physician on a regular basis.
See, I wasn't aware of this, and
Wow.
I do know a lot of people that have neglected either going to the doctor or don't have health insurance because they just can't afford it right now. So this is awesome. Why did you get involved in this? I know you've got a real passion.
I have a real passion for health and nutrition. I personally have some health challenges, and through my health challenges, I've changed my diet. I was listening to the meditation earlier.
Are you going to do the 8-week challenge? Jump on board.
I actually teach a 12-week weight management program, which teaches low glycemic eating, behavior modification, stress reduction.
A what?
It
That's a lot of words.
Me.
Is it?
Stress reduction, all
Stress
of the above,
reduction,
and other.
behavior modification, exercise, and low glycemic eating.
Oh.
So with all of that comprehensive, it really makes one solid environment where you can keep control of your health and your well-being, because eating low glycemic can really help with a lot of different health challenges, from inflammation, arthritis, fibromyalgia, which is what I have, as well as other type of inflammatory illnesses from just having a low glycemic diet and control of your sugars. So high blood pressure, high cholesterol,
wealth of knowledge.
triglycerides.
We're gonna
Increase your energy.
Yeah, we're going to have to keep on, talking to you about this when we come back. And then I want to bring it back and let's talk about women's health. And again, bring it back to Health Access RI and your New England Health Alliance. There's also drug discount cards that are available,
Yes.
so that freaking prescriptions
tell
are
you,
costing so much
I had to pick up
money.
a prescription the other day, and it was $72. I have great health insurance.
Oh my gosh.
It was the copay
I went
was
to
$72.
Was it for a new arm?
I said, really?
I went to CVS for my daughter ended up with an ear infection, and I went to CVS, and the woman in front of me, the clerk told her that her insurance didn't cover her prescription, and asked her if she had a AAA card. She goes to pull it out. I pulled out one of my cards. I said, well, see if my card helps her save more money. She was going to save $3 with the AAA card, and she saved $10 with this. She saved
Wow.
literally 50% off the cost of the prescription by using that card, and it's free for anybody. You don't even need to be part of the Health Access program.
People will drop their health care, or they lose their jobs and they don't have health care access, and they will not go to the doctor. And it's just, more people end up in the emergency rooms because they didn't go to the doctor, because they didn't have time and they didn't think they had the money to do it.
Right.
So first, hats off to the doctors that are actually actually part of this, the primary physicians that are seeing people for this really big discounted rate because they see that it's important.
They're a great group of physicians that
It's an
really,
amazing
really
program.
care about their patients.
Well, I think, and I see the same thing in you and everything that you do for, the Americans, what is it? I'm not even going to get it right. The AFPRI, or can you say
Rhode Island Academy of Family Physicians.
that thing.
She's got it
Rhode
down.
Island
That
Academy
thing,
of
yeah.
Family Physicians, and then, as you said, you teach classes. I know you deal with this other, we were just talking about healthcare and getting to the doctor. Well, we all know prescriptions cost unbelievable amounts of money. Pat, you just talked about it.
Yes.
Even when you have insurance. So you also have this other plan and option for people who don't have insurance. And even if they do, can they still use this card?
If they have insurance and their insurance does not cover their prescription, they can use this card. It cannot be in conjunction with. You can use it instead of.
All right.
So if your insurance, it's a discounted pharmacy card, and if your insurance doesn't cover your prescription, you can use this card and see how much it will save off of your prescription. It, on average, is 40 to 50%. In the last week, I've had 2 testimonials that it has saved 50% off the cost of their prescription, but it can save as much as 80% off certain prescriptions.
That's
off the
amazing.
cost.
Amazing.
It is. It saves hundreds of dollars a year on people that have to take monthly prescriptions.
All right, so tell us a little bit about the name of it and how people get these cards, and what's this process?
Well, they can call the 647-0040 or info@healthaccessri.com. I can mail it to them. I did leave the CVS store that I was at recently, left a stack of them with them. So
Did they keep them out on the counter?
She said she was going to. The clerk that was working at the pharmacy assistant that was working there said she was going to keep them out, so anybody that needed them would use them. So I'm hoping we can get more pharmacies that will call and be willing to have these cards for their clients that come in and be able to save them some money. So it doesn't cost anything for the cards, and they actually do not need to be part of Health Access to use the cards. They can just email
Just take the
or call
card.
me and just take it and use it.
Just take the card and use the card.
And
that's
there's
it.
what is there a catch? I got to ask.
I know,
what's the catch? It sounds so good, but there is none, right?
No, the company that we are working with is called Needy Meds, and they have worked out with the pharmacy, with the drug companies, with pharma, to offer the discounts. And they do offer, pennies, literally pennies. That's why we just hand them out to everybody. But they do offer pennies on the prescription back to us, and a little bit here and there. It does add up a little bit to help us pay administrative costs. So, but it does not cost the patient anything to be able to use these.
That's incredible.
That's incredible is right, because it adds up.
Mm-hmm.
Everyone's, for me, I have kids at the house and they've been sick, and a few here and a few there, prescription there, it all adds up. So
Have you seen a spike in the amount of people that are taking advantage of Health Access RI and these prescription drug discount, the discount cards with the economy over the last few years? Or what have you seen?
We've had, especially with Right Care and the changes in the policies of how they're covering people with their, the qualifications. So we have a lot of parents that have called up and said, I've been kicked off of Right Care and are no longer qualified. I shouldn't say kicked off, but no longer qualify for Right Care, or a child is no longer eligible. They've reached the age where they're no longer eligible and they want the coverage. So that I get a lot of calls like that. I do get a lot of calls of people that have lost their jobs and no longer have health insurance, can't afford the COBRA cost of health insurance. So this is a great way for them to work with a primary care physician and have that quality care and ongoing care and remain healthy until they find their next position that will cover them. It's also a great program for people that are in the hospitality industry, whether you're working for hotels or restaurants, or anybody that works part-time. Anybody that works part-time that doesn't have health insurance, it's a great way for them to be able to have that primary care services.
And you're saying small business owners. So small business owners,
you can't afford the insurance.
well, isn't that what's happening a lot now? Is that small business owners just can't simply? I've got a lot of friends of mine who have got 12 to 15 employees, and they say that the healthcare costs are just killing them. That they have to pay for their employees. So not that this would be necessarily an option, but for people that are out there that don't have the means and their business is failing right now, this is something that at least you can still all do for your employees, right, to make sure that...
We've had people call that said that their employer has dropped their health insurance. You know, they didn't lose their job, but the employer could not afford the health insurance anymore. So this is a great way, a great program for them to be able to, like I said, work with a primary care physician for their comprehensive primary care services and their sick visits, well visits, checkups, schools, sports, yearly physicals, family planning for women. And, you know, again, you have the discounts with our service affiliates for lab work for people that have high blood pressure and need to see a doctor on a regular basis, or diabetes, or, you know, have to have their blood tested frequently. It's a great program for people.
You know, and also, and I don't know if I should be saying this, but, you know, the last couple of primary care physicians that I've had, well, over my lifetime, are usually very good about if you go in and you're sick and they have samples, and you don't have to go get I think that's why it's important for people to remember. You know, we were talking during the break for people to know this, that I was asking Karen how many people are with Health Access RI, and it's not as many as you would think, considering what an incredible service it is. But you were saying, Karen, it's because people will go when they're sick, or they'll sign up when they're sick, and then they're like, oops, better. And then they'll kind of let it lapse. So
Right.
A little bit of a roller coaster there in enrollment, and people that are sticking with it.
Right. So people don't value, or it seems that people don't value their health, to be able to keep paying that monthly membership fee and working with that primary care physician on an ongoing basis. So they're sick, they sign up, they go, and they get, you know, tested or whatever they need to have done, and then they go a couple months, they go, oh, I'm feeling fine, I don't need to keep paying that, and they stop paying their monthly membership fee. So,
do you find that that there are people from the insurance companies that have a problem with, you know, you offering such great services, or is it pretty much everybody's out there playing on a nice playing field?
No, they're playing on a nice playing field, and it's not insurance, so it doesn't cover any major medical emergencies or hospital visits.
Yeah.
So insurance covers that. But with, you know, so we're not in insurance. So if you have to go to the hospital, you're still self-pay when you go to that hospital. So the insurance companies don't feel there's enough out there where people need insurance and can afford the insurance that, you know, we're not a threat to them.
And so how can people get in touch with you?
They can email me at info@healthaccessri.com. That's HEALTHACCESSRI.com, or at 647-0040.
I think this is just it's incredible information.
Get your cards. Get your prescription cards.
The
for
discounted
free
pharmacy
prescription
cards.
cards.
Right.
Unbelievable.
I got good information to pass on to somebody who might get some misfortunate times and not have a job or insurance anymore. So thank you for doing this,
Absolutely.
Karen,
Thank
and
you,
thanks for being such a great
Karen.
example and awesome woman.